I need someone to explain to me, like I am 5 years old, how it makes sense that a literal doctor who went through undergrad, medical school, years of residency, and is a full-fledged doctor, prescribed my son a life-saving medication that he needs for a diagnosis that he has received, and my insurance gets to say, no, he does not. Please.
I work for American Insurance, and here's the things I've had to tell people. So you know how you went to your doctor and your doctor consulted with an oncologist to see if that lump was cancerous? That's not covered by your insurance, and now you owe us $138. Yeah, you owe us $138 because your doctor consulted with another doctor. The cancer medication that you've been on for the last 3 years is suddenly no longer on the formulary. Your insurance doesn't even have to tell you that. They don't even have to tell you that it's changing. The cancer medication that you rely on, you can no longer get. And there's nothing we can do. Your out-of-pocket maximum resets every year. So you know how you just gave the healthcare company $10,000? Well, it's October and you're only going to get those benefits for another few months, and then you have to give the insurance company another $10,000. Every year. Every single year. You had nearly $10,000 saved up in a health savings account. Well, you changed plans last minute to save a little bit of money because you're old and retiring, and now all of that money is gone and there's nothing we can do to get it back.
Our family will not be enrolling in health insurance this year. Nada. I had a hysterectomy in April. I started seeing my gynecologist last September, knew that this was the plan. I have two insurances. One is Cigna. That is my employer-provided health insurance. I pay $76 a month just for myself. If I were to pay for my family, hence why we have the second insurance I got through the marketplace that is Better, so I am double covered. Okay, in case you did not know, this is for you insurance people because this is why I'm mad. Cigna would be primary. Why? Even if you had Better longer, it doesn't matter because it is a government subsidized individual healthcare plan. Employer plans are always before the government subsidized plan, no matter what. Okay? Had the hysterectomy done in April. I had to call and do a coordination of benefits once. I already had to do this. I had the hysterectomy in April. They called me in June and needed me to do a coordination of benefits and tell them Cigna is primary. Dealt with it. It's been handled. Get a call this morning from the gynecologist's office that Cigna is now calling and wants their money back. They want my gynecologist to send the money back that they already paid because they're saying again that Better was primary because I've had Better longer. Now, I've worked in insurance for a hot minute, and I am currently finishing my medical billing and coding degree, and let me tell you, I was ready to make the phone call and go to war. After an hour-long wait, I still haven't spoken to anybody. I had to call Cigna, and then they had some secondary company called like Coventry or something like that that they had to call and argue with. And they said, oh, there was a lapse in your coverage, it looked like, back in May of last year, and so you've had Better longer. And I said, I left my job for a month and I came back. But it doesn't matter how long I left. It doesn't matter if I've had Better for 10 years and I get a new job and I go have a procedure done and I now have Cigna. Cigna is always going to be primary. Always, always, always. There's no ifs, ands, or buts. You cannot use that. The only way that rule stands is if I had 2 commercial insurances or 2 of the government subsidized insurances. So if I had like Medicaid and Better, it's whoever you have the longest. If I had Blue Cross Blue Shield or United Healthcare, it's whoever you've had longer. But in the instance of a job provided insurance, a commercial insurance like Cigna, and then you have a government subsidized Better, the Cigna is always first. Okay? And now I've had to argue with 3 separate people about this. And it's simple. You look this information up online. Okay? But what chaps me more than anything is that we are now April, May, June, July, August, 5 months out from my hysterectomy, and you've already paid the claims. And you're wanting to not only get the money back from the hysterectomy that you already paid for, but you're going all the way back to September of last year and you're asking for your money back. No. I'm done playing this game. I'm done with insurance people thinking that they can control our lives, because let me tell you, last year, pretty close to the worst possible thing happened as far as like catastrophic coverage. My son had a really big fall. We had to be ambulanced to a different hospital, like all the big shebang. Okay. the big shebang. The hospital that we started out with wrote off his entire visit without me even having to ask. Without them even having to ask. My husband has his MAGA insurance because he is covered through the fire department. I pay for dental and vision separately. And so, you know what? No, I'm done with the insurance. I'm going to self-pay the hell out of everything. My son is on a prescription he has to get every month. It's $26. I'm done. We're done. I think there's a mass amount of people that are leaving the health insurance sector, and I'm all for it. Okay? You people cannot keep screwing with people's lives like this. And unfortunately, the system is against us because technically they have a year, which we're coming up on that, September. September is when all of this started. So some of those claims y'all aren't going to be able to get back. But you're going on 5 months after you've already paid a claim and then you want it back. There's no take-backsies. You people cannot mess with people's lives like this. I'm done. I'm out.
Democrats in the Senate voted to keep the government closed for the remainder of the weekend, and the question is, are there actually illegal aliens receiving Medicaid? That whole thing is the impetus of our shutdown. And whether you like this or not, it's an undisputed fact that under the Biden administration, there were undocumented immigrants receiving taxpayer-funded health care. Here are the facts. Last year, Medicaid costs for emergency services for illegal aliens skyrocketed 142%, totaling $9.1 billion. From 2020 to 2024, Medicaid spending for emergency services for illegals tripled under Joe Biden, up 196%. In 2023, under the Biden administration, South California's, and I quote, entire healthcare system was being bombarded by illegal aliens, enforcing American citizens to endure longer wait times. In Denver, Colorado, the CEO of Denver Health stated that 8,000 illegal immigrants made 20,000 visits to the city's health center in 2023. That all left an uncompensated bill totaling over $10 million. The Congressional Budget Office estimates that there are about 1.2 million illegal immigrants receiving Medicaid. Those are just a few examples. So that's why in the one big beautiful bill that was passed a few months ago, the Trump administration and Republicans made sure that those who are not American citizens were not receiving free taxpayer-funded health. Democrats want to add all that money back and give people who did not deserve free healthcare free healthcare. If somebody says to you there are no illegal aliens receiving Medicaid, you show them this.
The Republicans are to blame for this government shutdown, and do not let them tell you otherwise. I know you're hearing a lot from the skid mark in chief and vice skid mark in chief about immigration being at the forefront of issues that they can't agree on, so let's clear that up. More specifically, and more appropriately, they're saying that Democrats want illegal immigrants to receive free health care. And while I personally wouldn't give two shits if my tax dollars were used to fund the health care of human beings, that is not the case. Anyone with half a brain, or even so much as their pinky toe dipped into the conversation about immigration, knows that illegal immigrants do not qualify for federally funded public benefits. In fact, the one big ugly bill actually narrowed the eligibility of legal immigrants too, despite the fact that all of them pay taxes. What if the illegal immigrant goes to the hospital? We can't deny them care, so we pay for that care. That was my impression of a mouth-breathing Trump supporter who doesn't understand that less than 1% of total Medicaid spending goes towards that exact situation. You can use Google too. It's not just for the left. You can also look things up. But I took it upon myself so you could see what Democrats are actually trying to do. One, they want to extend the enhanced federal subsidies of the ACA that are set to expire at the end of this year. Because if that lapses, premiums for Obamacare policies in 2026 are expected to skyrocket by more than 75%. These subsidies help low-income Americans have health care coverage. If you voted for Trump and you're on Obamacare, you should be pissed right now, if you even had the attention span to make it this far into the video. The other thing Democrats are trying to do is to reverse the historic cuts to health care, particularly Medicaid, contained in the big ugly bill. It has nothing to do with illegal immigrants. Trump and the Republicans are just trying to fearmonger their base to blame the Democrats for a government shutdown that they caused. You have the House, the Senate, the White House, and you are trying to blame the party that's negotiating on behalf of tens of millions of Americans who you are trying to take healthcare from. If you believe a word of what Trump and the Republicans are saying about this, kick rocks, you brainwashed freak. Oh yeah, and just so we don't forget, release the Epstein files.
I do not like living in a country where people need to resort to crowdfunding through GoFundMes in order to be able to afford to live, in order to get surgeries that they need because their insurance has rejected them. I don't understand why politicians don't seem to comprehend that the reason that the American people were supporting somebody who allegedly murdered a healthcare CEO is because they are angry about their loved ones and themselves being forced to be in pain for years, or even worse, having to die because they literally cannot afford to treat their health. And the Republicans are only making things worse. It's interesting when you look at like cause and effect in the United States. Like Americans never really get it right. When I tell you they don't learn the lessons from the past, it's like we saw the fallout of the war in Iraq and we were like, let's go to war with Iran. Even with the situation with the healthcare thing. Like that healthcare CEO was killed. I don't even think it's been a year. And Republicans have now already passed a bill that is going to kick so many people off of their health care. The American people said, we want a better healthcare system, one that's easier, that actually works for us. And the Republicans said, okay, I got you, and made it harder for certain people to access their health care. The fact that we don't have universal health care in this country is a joke. And that's one of the things that it's like, until that is addressed, like, and we can't even imagine the scale because, you know, you think to yourselves, like, how many people's lives could have been saved if it wasn't for this horrible healthcare system? You know, like, literally how many people, it was a surgery that they needed, it was a treatment that they needed, maybe an experimental treatment, but they didn't have the funds for it and their insurance wasn't willing to cover it. But also think about how many people, they are not going to these kinds of like preventative checks. How many people, like, their cancer could have been discovered, you know, years ago, and at that point it would have been treatable, but people aren't going because they can't afford the visit. Like, does that sound like a just and moral society? Like, you're basically just playing like Russian roulette, hoping that you don't get a type of illness that you can't treat, hoping that you don't become sick enough that you won't be able to work, otherwise your healthcare like this. I'm extremely disturbed. Every time I see, you know, a GoFundMe, someone talking about how, you know, they have a condition and they're not able to get the treatment that they need. Sometimes I see, you know, wheelchair users that are doing GoFundMes for, you know, wheelchair accessible vans and transportation and stuff like that. And it's like, this is not a humane society. Like, in a humane society, you shouldn't have to beg for the things that you need to be able to live, you know? And when you think about the way that this interacts, like how deep it actually gets, because it's like, think about all the people, for example, who are self-medicating, you know, pain, chronic pain, issues that they have with drugs, right? And then, because the government has criminalized drugs, they're then punished and put in prison for self-medicating issues that they wouldn't have been able to afford to fix. You see what I'm saying? And the fact that even amongst our left party, the Democrats, it's not like popular to push for universal health care. Like, universal health care is a fringe belief in the Democratic Party. The main, you know, people in the Democratic Party are not pushing for universal health care. This is so ridiculous. It's like they keep talking about like, oh, we need to expand coverage to this, to this. No. We need to completely get rid of this system of privatized health care. It sucks. Everyone hates it. How are we going to get the money? How are we going to get the money? Figure it out.
So I just made it home from the doctor, aka the health clinic, because I don't have insurance or money to pay for a doctor, but I'm having some health issues, and I figured the clinic would be an affordable option to me. Much to my surprise, they thought that $32,000 to make in 1 year was not eligible for like sliding scale, and I understand like the poverty amount and things like that. But $32,000 in New Jersey might as well be poverty at this point. But still, I don't have $110, so I put it on the credit card, much like all things I've been doing for the last year and a half. Doctor couldn't really describe what was wrong with me. I've been having hives around my eyes, and they've been swelling for like 2 months straight now. It goes away, it gets better, it gets worse, and largely it's triggered by work. The job I work for profited, I think, $15.3 billion last year, but they can't insure me because I'm not a full-time employee, because they cut my hours, because I wouldn't do illegal things, and I was also tired of my manager telling me about the affair she was having with other managers in the store, and I kind of developed a bad relationship with management over it. And the illegal thing that I wouldn't do, they're now facing a class action lawsuit over it. Anyway, so they decided to cut my hours a year and a half ago, and I was like, great, I don't want to fucking work here anyway, so that was a choice that I made. Great, let's do it. I fucking hate this place. So yeah, the doctor didn't really have answers for me. He did blood work, sent it to the lab, which is another $250 for me to pay. And so I went back today for a follow-up to go over the results of my blood work, which I sent to my sister, who's a nurse, and she gave me some suggestions of what I could do. And my symptoms are kind of much better. A lot of it is stress-induced, and it could be a histamine intolerance. It could be mast cell activation. It's something along those lines. My sister has an autoimmune, and so does my mom. So I feel like it's possible that I'm like brushing up against something like that. So I went back this week for my follow-up, and they told me it was another $110. I was here last week though. This is just a follow-up. We're just going over my blood work. They're like, yeah, it's another 110. So I opted out. I said, I don't need to see the doctor. And granted, you want to know why I'm out in the street screaming fucking free Luigi. This is a really good example, because had it been anything worse, who knows what could have happened. And people actually die over shit like this every fucking day in America, and people aren't outraged. And people look at me like, oh, you're supporting a murderer and a terrorist. First of all, he's not a murderer, nor is he a terrorist. It's frustrating, it's infuriating, it's maddening. Most of my credit cards are maxed out. I have no fucking money. Any of the jobs that I've been looking at will pay me less or the same, and I'm gonna be in the same fucking loop anyway. All the while, I need to hang on to like this like shred of hope that it's all gonna change for me any fucking day now, which I truthfully believe.
Okay, so we all know how America has no universal health care, right? Tell me why, though, when you have insurance, when you pay monthly for your health insurance, why doesn't every fucking healthcare provider take the same insurance? If you have insurance, you should be covered wherever you fucking go. Why is this not a thing? Why is it that in Europe, in European countries, they have free healthcare and they can go wherever for their healthcare, but we pay hundreds, sometimes thousands of dollars a month, depending on how many people are on it, and there's only certain providers we can go to? I don't understand who set the system up, but we need to fix it. Why are we still dealing with this? It is almost 2026, and people can't get healthcare, even though they pay hundreds of thousands of dollars a month for healthcare. They can't find a provider. What the fuck are we doing as a country? What the fuck are we doing?
You can't scream it's about healthcare when you shut down the government to stop services to the very citizens who rely on it. Democrats are fighting for revisions that actually cut $50 billion from rural hospitals. These are the same hospitals that they claim women would suffer without. And while they point the finger at Republicans for not negotiating, there is nothing to negotiate. The continuing resolution is the exact same one they voted for 13 times before. There's nothing new. But this time, the Democrats loaded it with $200 billion in healthcare provisions. Not for you, not for your family, but for non-citizens. That's Medicaid, Medicare, Obamacare, all funded by your tax dollars. And the part they don't want you to know is that they slipped in a loophole to the insurance companies so that they can bill Medicaid at higher rates for illegal immigrants than for American citizens. That scam alone is $28 billion, on top of $6 billion carved out for illegal immigrants with criminal records so that they could get healthcare too. So tell me, how does shutting down the government or dumping another $200 billion we don't have help a single American citizen? Oh yeah, it doesn't. I need to wake up and stop voting for these people who are voting against you.
The attack on healthcare just escalated. In the last week, 100% tariffs were put on prescription drugs for companies that haven't broken ground on manufacturing here in the U.S. Insurance companies are routinely denying claims for treatments for things like MRIs, CAT scans, and just normal solutions that your doctor prescribes. Even surgeries and necessary cancer treatments are being denied. Copays, deductibles, out-of-pocket expenses have gone through the roof. You've got to be worried about it. I know my family is. And the government shutdown, what the Democrats are fighting right now is to change what they're talking about with the ACA, marketplace insurance, because they're trying to get rid of it. This is all in Project 2025. If you don't believe me, go look it up. They want to do away with Obama-era marketplace insurance plans, and it's all subsidies will disappear. It's going to make insurance unaffordable to a large part of the population. Insurance companies don't want the regulations. Remember before Obamacare, they were able to deny you insurance coverage based on pre-existing conditions? That was all wrapped up in the ACA stuff. That goes away at the end of 2025. So what do you think is going to happen with these private insurance companies that are owned mostly by private equity? You think they're going to continue to cover? No, they're out to make money. That's all they really, really care about. I see a lot of people talking about buying catastrophic insurance and then paying out of pocket cash to do normal stuff. That's not doable for people with chronic illness. That's not doable for people that are low income. There's a big problem, and 2026, we're going to see major healthcare crash. America is the only wealthy nation that does not offer universal health care to their citizens, and now they want to privatize it more. It's wrong. Go read my blog, follow my Substack or my blog on my website, bernadettegold.com, and you can learn about taking control of your health, because being healthy is a sacred form of protest, especially today.
This video is for anyone who bought health insurance on the ACA marketplace. But if that does not describe you, please still stick around, because our country is on the brink of a legitimate healthcare disaster, and I desperately need y'all's help. Here's what's going on. Unless Congress intervenes in the coming weeks, the cost of health insurance is set to go up by about 75% for millions of Americans come the new year. That is quite literally thousands of dollars more each month. Money that, frankly, most families do not have to spend right now. The reason for this massive cost increase is twofold. First, health insurance companies have asked regulators to allow an increase in premium rates, citing this guy's big, beautiful bill, as well as the impact that his tariffs are likely to have on the cost of things like medications and medical equipment. Second, and this is the really, really big one, the enhanced premium tax credits that helped make ACA coverage more affordable for most Americans are set to expire at the end of 2025, and Congress has yet to take action to extend them. And that is where you come in, and why I say I need your help. People enrolled in the ACA are about to start receiving letters in the mail from their health insurance company notifying them of how much the cost of their existing health insurance plan will go up in the new year. If you receive one of these letters, please take a photo of it and send it to me. I will not publicly share any letter sent to me, and you are welcome to redact every bit of personal information from that letter before sending it to me, as long as the dollar amount is still visible. When you send it, please share with me what impact this cost increase would have on you and your family. Things like, will you be able to afford it? If not, how is that going to impact you and your family? Are you going to have to cut other things out of your budget to make it happen, or is it just not possible? You can share as much or as little as you are comfortable sharing. My goal here is to help voters see the very real people, real lives, and very, very real devastation that will be caused here if Congress does not intervene. Again, nothing that you send to me will be shared publicly unless I have your explicit permission to share it. And please help me get this call out to as many people as possible by reposting this video and engaging with it in all of the ways possible. My videos are getting suppressed right now, as a lot of other content creators are also experiencing. So anything you can do to help me get this call out there to folks is so, so appreciated.
One of the reasons we currently have a government shutdown is Democrats have been advocating for maintaining and extending the subsidies to the premiums for those who obtain health insurance through the Affordable Care Act marketplace. There are currently 24 million people who obtain their health insurance through the ACA marketplace. Of those, 20 million of them benefit from these subsidies on their premiums. If those subsidies expire, that means 20 million people will see vast increases in the premiums for their health insurance. There are various amounts by which these premiums will change depending on a number of factors, including income level. But for those who have the lowest income, for those making less than $25,000 a year, the premium would increase by 573% if these subsidies expire. The premiums would also go up for those who were not getting those subsidies, because there would then be fewer people who are going to be able to access health insurance this way. And since there will be fewer enrollees, the price for everyone who remains will go up. The Congressional Budget Office, which is a nonpartisan organization, estimates about 4 million people will end up losing health insurance if these subsidies are allowed to expire, which is what the Republicans would like to do. I'll give one quick example that's easy to understand. A 60-year-old couple who makes $85,000 a year would see their premium rise over $22,000 per year if the subsidies are allowed to expire. KFF estimates on average the premiums would more than double. I'm just wondering, is this how we make America healthy again?
Donald Trump is about to remove 390,000 New Jerseyans from Medicaid because of this government shutdown. And guess what? Jack Ciattarelli says he has nothing he disagrees with Donald Trump on. We say no to that. No to Jack Ciattarelli and no to Medicaid cuts. So that's why on October 8th, at the next gubernatorial debate in New Brunswick, we are organizing with healthcare workers and organizations around the state to protest Jack Ciattarelli. I am serious. I need you there. I need New Jerseyans who say, we support funding for cancer care, for kids, for mothers, and everything else that a person may need for health care covered under Medicaid. We will not back down, and I encourage you to go to the link in our bio and RSVP. Bring your friends, bring your family, and let's get this shit done.